Hi, it's Becky here, and just giving you a quick run through on the check and challenge process. I'm just going to share my screen and give you a few highlights about where we are and what's needed. So, you know that we have three propositions for universal healthcare: medicalising poverty by doing the best in the world that we think we can do in primary care. We're sticking plaster in poverty. It's not necessarily the best thing to do. Providing services that are not accessible to all. In the vaccine, we learned that the best thing to do was to go to people if we really wanted to meet their needs, if we wanted to vaccinate people. What lessons have we learned from that? What do we need to do now in terms of developing not just primary care services, secondary care services, that as close to people's homes as possible, particularly to address inequalities in provision? And the last thing is just rationing, understanding who is getting and who is not getting services. Where are we in the whole process? Last summer, we undertook some data mining. We had a look at what was really going on around here. Over the autumn through to the winter, we co-created solutions, local people sitting alongside NHS staff, leaders, frontline, third sector, voluntary community sector, local government. We came up with what we cared about and what we wanted to test. Over sort of December through till now, groups have been working on a sets of prototypes, change programs where they need to test specific parts of that to see if it works. Now we're into a community of practice this week, and we're moving into a point where it's about, do we want to adopt these? How are we going to spread them? And we're doing that through this prototyping process, just doing these weekly iterative cycles of testing certain elements of the change projects, building their network, and now they come in front of you. And your job is to check and challenge, to work out whether this is something that you can put some effort behind and at what scale it should best work at. In terms of the sorts of prototypes we've got a whole load around access, mostly about making sure that we go to people and don't come to us. For instance, in Sussex, we've got one around people with drug and alcohol dependency. In the vaccine, you were able to go and meet them wherever they were within the third sector, in their groups, where they were getting food. Suddenly not able to do that for primary care services. This prototype really tests, how do we bring primary care out to those folks wherever they are? And we've seen one in Bradford around doorstop and wellbeing initiative. We've got some around access. We've got some around how we make our luck with the third sector. Again, around access. How do we partner and collaborate better with the third sector? As a theme, particularly in Hastings, about people who don't speak English needing specific provision. And then we've got a whole set around medicalising poverty. The themes here are primarily around providing continuity and proactively managing people who turn up frequently with the help of the communities and the third sector. And we've got some around rationing. Those are particularly around whether we're providing, particularly children and young people, how do we help people have a healthy mind in Bradford? In Sussex, how do we develop child-friendly primary care practices? Each of the groups has been beginning to think about what makes things work. They had some conversations in their workshops about that, and now we're into sustainability and spread. I'm going to share the actual process of the check and challenge with you now, which is what is it you're going to be asked to do. So these change groups have been working up, what are they learning, what are they seeing, and what do they think about whether what they've got works, what needs to change in the system, at what scale, and how you can spread both the learning and the ideas. And your job is to help tease that out. So each of the groups is working on a check and challenge process, a really nice document. In it includes things like what they think their risks are. It includes what proposition they're addressing, and at what scale they think this proposition, their proposal should be utilised. So do they think Bradford, West Yorkshire, or Hastings and Sussex for the Hastings and Sussex one? They have different proposal forms for each group. Check and challenge panel. Now, we have used the Lennox sustainability questions. This is really well researched and well known in the NHS, not necessarily to NHS leaders and managers, but it's how lots of projects are evaluated to determine whether there's something that can stick and spread. So in the check and challenge, you'll be given the proposal by the group. This is where we've got to. This is the proposition we were addressing. in terms of universal healthcare, in terms of making sure that everything, that services are fair and equal for all. These are the ideas we had. This is how we got here. This is what we've tested. This is what we think needs to happen now. And these are the criteria that we're going to ask you to work through, and you get the forms to fill in here too. So for each of these proposals from the Chamber Group, let's take our drug and alcohol services and bringing primary care closer to those services in Hastings, or how we might use local communities and faith groups and local leaders to begin to do some of the basic health checks in Bradford. So just thinking about your own commitment in terms of your work program, your sphere of control, the things that you think matter. What do you think? Do you think it's impressive? Do you think this is something that's needed? Are you convinced by the group and what they say? Do you think this is something that you would be able to commit to in terms of supporting and leading this group? They're looking for a home. They're looking for ongoing support. Is that something you feel connected to? The next one is involvement. Have they involved the right people? Is there anybody missing? Do you think they should involve more people? Are you happy that they have managed to involve enough diverse voices for you to have a proposal from them that makes sense? The skills and capabilities involved. Have they got the right skills in terms of where they've got to? What skills and capabilities might you need if you were going to adopt and spread this? Do you think there might be training needs around this? Do you think if you were going to, for instance, take the street-based community checks for blood pressures, if you were going to do that across the whole of Bradford, do you have the skills in your teams to do that? Is there a willingness to do it? If we're going to provide drug and alcohol services close to where people are in collaboration with the third sector, is that something that you think primary care across the whole of Hastings would do? Thinking about leadership, they've been led by an emergent group, people who've just put their hands up and said, I'd like to do this. Now, where do you think the leadership should sit? Is there a program that it should sit in? Should they hand it over? Are they the right people? Could they lead it for you? Are they able to do that? So just the conversation really about leadership, about their willingness to carry on, their willingness to make this happen, whether they need to be knitted in or partnered with leaders in the system that are most appropriate for it. Team functioning, just thinking about the workload of the initiative and what you think needs to happen here. The team will have worked reasonably well together to try and do this. Ask them about things that were problematic. Where did they get stuck? Where did they face challenges or barriers in terms of collaborating with other people? Get a sense of how this team is working and what that would mean for other teams who are trying to do this work. Are there resource issues, staff, time, equipment, facilities? How much resource did they use and commit to this? They've done it all without any specific funding on the whole. So how did they manage to find the time to do it? Is that something that could be adopted by other teams, by other groups? Would that require any resources? Let's just have a think about that. Have they done anything in sort of monitoring around their learning? What can they tell you about what they've learned, about what makes this work, about how it worked? What are they thinking about? The process by which you could spread this idea, this initiative. They should have learned a lot about how to do change, and they will have that in their proposal. Evidence the benefits. Have they done any measurements? They're quite early on, these prototypes. They've only been working for a couple of months. They might not have really fantastic metrics here. They might have some indicators. They might have some tacit knowledge, some hunches. Would you like them to do more about that? Is that something you think matters? Is that something you'd like to pay attention to? Do you think the process was robust enough in terms of the prototyping? And just remember, with prototyping, you're testing small to see if something works. So you're just working it out at a scale where it's possible to find out if this is a good thing. You might only have done something with 5 or 6 patients. What have they learned from that robust process of doing it at a small scale? What matters around that? How might you spread it? Alignment with your organisational culture and priorities. Does this fit with Bradford, Hastings, Sussex, West Yorkshire in terms of your intent, your mission, your strategies? What sorts of values and beliefs are held within your own organisations around how you might support work like this? Does it feel like something that you would commit to around your own sense of change, of values? And then finally, are there any sort of any contextual issues that you need to be aware of when you're thinking about this change initiative? And then you've got to think about what change does it need to take place. Do you think this is something that should take place at a neighbourhood community partnership, locality level, across Bradford? This is the Bradford one, or in Hastings, across West Yorkshire, across Sussex. What scale does it need to take place? And does it have the authority and leadership to do this? Or do you need to gift that to the group? Or do they need to hand it over to somebody? So that's where we're asking you to really be a check and challenge group. It's a little bit Dragon's Den-y without it being too feisty. So your job is to try and work out where have they got to, what should happen now, how do you embed it in your system? It might be that what you're embedding is some learning from it. It might be you're embedding some actual process that they have tested and you now want to do. For instance, Hastings, for people with drug and alcohol dependency, you might say, actually, we want this to happen across primary care, across Hastings, across Sussex. If you're talking about street level cardiovascular checks or cervical screening, or how we might screen and support people as close to home as possible, is that something? Do we know enough about that now? Have we got enough street spot involved in this? Have we got over all the hurdles? Do we understand how GDPR works? Do we understand how we protect people's identity? Do we understand how we work with the third sector? Is that something we now know we can do at scale across Bradford? Is that something we would want to do across West Yorkshire? And how might we do that? And when you're thinking about how might we do that, we've got a number of vehicles. There'll be the things that you can do within your program boards or your partnerships, but there also might be things you can do through community practice with us working with you across Sussex, across West Yorkshire, to help other places learn and adopt. So we're looking forward to hearing what you think around the check and challenge, what you think about the viability of these propositions, whether you think they were really interesting and we've learned some lessons and it's the lessons that we're going to take on, or whether you think the actual prototypes and the initiatives as presented are something you want to adopt and spread. Thanks ever so much. Look forward to hearing from you.